Hello, I'm Tammy Dana-Bashian, Mayor of Rowlett, and with me is Michael Gallops, Rowlett Chamber of Commerce President. We are here today to talk about Governor Abbott's plan to open Texas for business. Michael, it has been a long and difficult 6+ weeks for our residents since this coronavirus started impacting our region.
Yes, Mayor. Our residents have really stepped up and sacrificed personally and professionally in order to safeguard our community, protect our vulnerable citizens, and preserve our healthcare system.
And all of us are so grateful for everyone's extraordinary efforts during this incredibly difficult period. We are not out of the woods yet by any means, so it is still critically important that we all remain diligent in our COVID-19 prevention as we move forward with the governor's plan to open for business. Michael, with the healthcare risks still out there, can you please help our viewers understand why now is the right time for the governor to start opening our economy?
Because Texans have prioritized health and safety, COVID-19 infection rates across the state have been on the decline for the last 17 days. The rate of hospitalizations has held steady, with hospital capacity remaining abundant. In Rowlett, we have certainly experienced the results of this virus, with 2 tragic deaths and 48 confirmed cases. And regionally, some areas of Dallas County, including the city of Garland, have been hotspots for confirmed cases. But COVID-19 has also wrought havoc on our businesses and workers affected by the restrictions put in place to protect human life. As you said, it is critically important to continue to follow the health guidelines as we reopen Rowlett.
And those critical health guidelines include: stay home if you can, wash hands often and for 20 seconds, or use hand sanitizer with at least 60% alcohol, cover coughs and sneezes with a tissue and throw that tissue away in the trash, avoid touching your eyes, nose, and mouth with unwashed hands, disinfect surfaces, buttons, handles, doorknobs, and other places touched often, avoid close contact with people who are sick, continue to practice social distancing, avoid crowds, and limit physical contact, and wear a mask or cloth face covering in public to help slow the spread of the virus. This is especially important in cases when social distancing is not always possible, as we are finding that there is a significant percentage of the population that is asymptomatic but can be carriers. So the governor has issued Executive Order GA-18, which is effective immediately and continues through at least May 15th. Michael, let's go through some of those details.
The executive order states every person shall continue to minimize social gatherings and in-person contact with people who are not in the same household, except to provide or obtain essential services or reopen services. People over 65 are strongly encouraged to stay at home as much as possible. Essential services continues to be defined by the U.S. Department of Homeland Security in its guidance on the essential critical infrastructure workforce. A new category, reopened services, will be allowed statewide starting this Friday, May 1st. In providing or obtaining essential services or reopened services, people and businesses should follow the minimum standard health protocols, should implement social distancing, work from home if possible, and practice good hygiene, environmental cleanliness, and sanitation. So Mayor, let's talk about that new reopened service category in more detail.
Starting Friday, retail stores, restaurants, movie theaters, shopping malls, and museums and libraries may operate at up to 25% of the total listed occupancy. However, interactive displays, child play areas, and food courts must remain closed. Drive-through, pickup, or delivery options for food and drinks remains allowed and is highly encouraged. It is important to understand that these conditions for reopened services of 25% or less occupancy do not apply to essential services. Reopened services also include services provided by an individual working alone in an office, golf course operations, and local government operations. The governor has the ability to discontinue reopened services for particular counties based on factors such as an increase in transmission of COVID-19 or in the amount of COVID-19 related hospitalizations or fatalities. Michael, what are some of the areas still not open for business?
The governor's order specifies that bars, gyms, public swimming pools, interactive amusement venues such as bowling alleys and video arcades, massage establishments, tattoo studios, piercing studios, and hair and nail salons remain closed. Additionally, people still may not visit senior care facilities unless to provide critical assistance. The medical team for the state is working on safe ways to open personal service businesses as well as summer camps. The good news is that visiting parks, hunting or fishing, jogging, bicycling, and other outdoor sports are allowed and encouraged if in-person contact with people not in the same household is minimized. Mayor, I know one area people are very interested in, which is the ability to conduct religious services. What is the current guidance on this?
The Attorney General and the Governor have jointly issued guidance on religious services, the latest of which was issued April 27th and includes: religious services are defined as essential services. As much as possible, activities should be conducted remotely. Services not conducted remotely should follow minimum health protocols, including encouraging the at-risk population to participate remotely, providing a separate area in the facility or separate service for at-risk population, ensuring proper spacing between attendees, screening employees and volunteers for illness, employees and volunteers following proper hygiene and social distancing, encouraging face coverings, and maintaining rigorous sanitation practices for the facility. Any other details on actions by the Governor, Michael?
Yes, Governor Abbott issued 2 additional executive orders. GA 19 specifies that all licensed healthcare professionals can return to work as long as they meet their licensing agency's minimum standards for safe practice during the COVID-19 disaster. GA 19 also requires all hospitals to reserve at least 15% of their capacity for treatment of COVID-19 patients. The governor also issued Executive Order GA 20, which revises the quarantine requirements for travelers from specified points of origin or points of departure. Mayor, can you talk about how these new orders from the governor impact Rowlett businesses and citizens, and what happens with the order that is currently in place for our city?
Michael, one of the most confusing areas over the last month and a half has been the ever-changing and differing orders issued by the various governing bodies, as well as their inconsistent interpretation and enforcement. Never have we experienced a disaster like COVID-19, and navigating this process has not always resulted in smooth sailing. The governor has made it very clear that his new orders are the governing documents for all of Texas. This means that local, county, and city orders may not restrict essential or reopened services, may not expand essential or reopened services, and may not allow gatherings prohibited by the governor's executive orders. Because opening Texas is a complex operation, the governor has also issued the Texans Helping Texans publication. Available on our website, it provides detailed guidance for individuals, retailers, customers, restaurants, movie theaters, museums and libraries, outdoor sports participation, places of worship, and single-person offices. To wrap this up, Michael, can you talk about some of the future plans the governor unveiled?
The governor also talked about phase 2 of his plan, which could open businesses up at 50% of capacity by May 18th, but only if data shows that the virus is being appropriately contained. The ability to test and trace contacts for positive cases is critical as we open our businesses and services to restart our economy. Providing rapid results, Texas currently has the capacity to perform 15,000 to 20,000 tests per day, with a goal to soon reach 30,000. State testing resources are currently focused on hospitalized patients, symptomatic individuals, residents in long-term care facilities, healthcare workers and first responders, and those over the age of 65. Tracing those who have come in contact with an ill person is also imperative, so additional statewide resources, such as an increased workforce and call center operations, are being implemented in phases. More testing information is available on the rowlett.com/COVID-19 website.
To all our residents, a heartfelt thank you for everything you have done and will continue to do to keep our community safe. This is an important first step to getting our economy up and running again. We will only be successful with your support, so please keep up the good work and stay diligent with your social distancing, proper hygiene, and sanitizing practices, and wear a mask to protect others when social distancing is not possible. God bless, and please stay safe, stay informed, stay kind, and stay home when you can.